sounds obvious, but good medical AI needs good science, and there are no shortcuts. Our medical experts regularly expand and review ADA's knowledge base to make sure it reflects the best and most up-to-date clinical practice. Our doctors and scientists built ADA's probabilistic reasoning engine to understand thousands of symptoms, factors, and conditions, including some of the world's rarest and most complex. We continuously improve and optimize our AI so our solutions remain the safest and most accurate.
Hear in their own words why they should win.
Our superpower is really about placing the world's combined medical knowledge into the hands of millions of people. It's basing AI in clinical excellence and really having the human touch in the AI. Our success is a result of us being able, a joy to use, our accuracy, our safety, our advice, and the fact that our AI is being trusted as part of millions of people's everyday care experiences. For us, healthcare is not about the competition. Obviously, there's lots of amazing companies working together, including all the guys and teams involved in this awards. But it's about medical compassion rather than competition. It's about working together. It's about integration. It's about breaking down barriers, and really, it's about safety for our users and the users of everyone's solutions and the patients. So our commitment to medical quality and safety is second to none. The way our human clinicians are involved in the safety and assurances behind our AI. We involve clinicians every stage of the process, so from developing to continually testing it and monitoring it for safety and performance, and refining it to ensure the highest accuracy and the most comprehensive condition coverage and the trust that builds. Millions of people love using ADA every day. Every few seconds, someone turns to ADA for advice that they trust and can take action on. They tell us every day that we make a difference for them, their loved ones, their outcomes. Clinicians around the world trust ADA, which is a real differentiator for us. And internationally recognized healthcare leaders, real leading organizations and systems are increasingly turning to ADA with life science health systems insurers as their choice of AI partner. And we believe that sets us in good stead for the UCSF jury.
Radiology departments reach out to ADOC when they look to improve their workflow utilizing the latest advances in artificial intelligence. Our AI is always on. It constantly runs in the background, analyzes every relevant exam right after the patient left the scanner. And once it detects this critical abnormality, we help the radiologist by highlighting those critical areas to help him prioritize life-threatening cases and really expedite patient.
Hear in their own words why they should win.
I think our superpower is that we make our customers, radiologists predominantly and additional acute physicians, superhumans, right? Our technology augments their power, and together we work to improve patient outcomes and improve patient care. So I think that from our end, it was important for us to start with understanding how radiologists work. This is how we started. We wanted to get their buy-in to using a tool that is actually, as I said, going to help them improve patient outcomes. It was important for us to be very integrated into the way they work, so that they didn't have to change anything they do. And we also knew that we needed a tool that actually provided a lot of value. It wasn't very specific to only one type of use case that they were going to use. And so I think that would maybe differentiate us. We're very comprehensive. We're heavily integrated into the way our radiologists work. And we're also able to expand this to whoever they want to bring into the discussion. So if it's neuroscientists, if it's cardiologists, again, this is sort of the holistic view of how you're integrated into a backbone of a hospital with an AI sort of infrastructure that then enables you to provide these solutions across the board. I think AI in healthcare is such a buzzword, so I think it's at least on our end, we've been working with physicians for almost 4 years now. We have 7 FDA clearances. We cover a very high portion of of the radiology workflow and the radiology use cases in an acute perspective. We focus predominantly on acute cases, so on actual life-threatening pathologies that require immediate attention. Radiology, right, 90% of patients today have some form of radiology intervention, so that's a very important field that really needs the assistance of AI. We're installed, 1 out of 10 scans today is analyzed by our solution, so we're heavily used, we're well received. I think that's probably why we actually are able to show clinical outcomes on a day-to-day basis, improving patient care and getting to patients faster.
HeartFlow is transforming the diagnosis of heart disease with the HeartFlow analysis, a non-invasive, personalized cardiac test that combines 30 years of human ingenuity with advanced technology, putting patient care first.
Hear in their own words why they should win.
I would say our superpower is literally X-ray vision. We use our AI, human-in-the-loop AI, to enable physicians to read through cardiac CT data with a lot of disease, great complexity, and we provide information on whether the disease is limiting the blood supply to the myocardium and whether the patient is at risk. If this is done early enough, then patients can benefit and they don't have to ultimately die from heart disease. Heart disease is eminently preventable if it's diagnosed and treated early. What really differentiates us is really our maniacal focus on quality for patients and also overwhelming clinical evidence. More than 400 peer-reviewed clinical papers. One of our latest ones showed that we could reduce death, all-cause death, from 20% to less than 8% at 2 years in a high-risk patient population with heart disease. And again, it's this dedication towards providing clinical evidence to tackle the world's leading killer. We're leveraging AI to eliminate heart disease as the leading cause of premature death. It's, as I said, heart disease is eminently treatable if it's caught early, if it's diagnosed early, and if patients are managed appropriately.
Diagnostics for infectious disease need to be accurate, quick, and comprehensive. But doctors often end up in a frustrating maze of wrong turns and blind alleys with diagnostic tests that don't enable a clear diagnosis. That's why there's the Carious test. It's a breakthrough liquid biopsy, and it's powerfully simple, requiring just one single blood sample. It's time to get out of the frustrating diagnostic maze and bring immunocompromised patients back to health.
Hear in their own words why they should win.
Carious was founded on the discovery of microbial cell-free DNA. The technology we developed on top of that discovery gives us a unique ability to address a deep unmet need in infectious disease diagnostics. The technology allows us to diagnose an ever-growing diverse set of infectious agents without the need of a biopsy or any substantial changes to the underlying chemistry. Our molecular technology allows us to expand what this test can do through continuous data, software, and machine learning updates. That AI technology, combined with the foundational molecular technology, is putting us ahead in this important race.
At Diagnostics, we've developed a technology that helps patients and doctors skip having to wait and get lab-grade results in minutes. We tackled the world's most common blood test, the complete blood count. CBC is used by doctors as a first line of questioning for patients with fevers, low energy, routine checkups, and also infectious diseases like COVID-19. Olo captures 1,000 high-resolution images from each blood sample. This digital blood sample is analyzed by our own AI algorithms to provide diagnostic results using just 2 drops of blood that can be collected from a finger prick.
Hear in their own words why they should win.
We've created an accurate medical diagnostic system that digitizes blood by automatically collecting over 1,000 images from a single drop of blood. Our compact analyzer, Olo, provides the same diagnostic accuracy as the bulky equipment often found in large labs. Not compromising in accuracy was key for us, as we want the physician to never have to choose between speed and quality. Sight's AI-driven platform is addressing this gap, starting with the most common blood test, the complete blood count. We deserve to win because we are leading the charge in this diagnostics revolution.
Sign up to attend the grand finale on October 7th in San Francisco to see the winners crowned.